and the time allotted to me is very short, but that's less difficult because I'm an Italian. So I'll try and do my best. And I'll try and answer a question, first of all. Can migrants have full access to healthcare services? We think, and me and my colleague, of course, my colleagues, that access can be greatly improved by training professional healthcare interpreters for European languages, but not also for languages of limited diffusion. And I'd like to go back to the previous slide if I can. Not very good. Okay. But I will simply say that this migrants' right to have access to healthcare services is, of course, laid down by our Constitution first, but also by the Charter of Citizens' Values that was implemented in 2007. So we know this. We all have access to services, but how can we do that? In Italy, we have quite a special situation, meaning that, unfortunately, public service interpreters and medical interpreters in particular have not yet received the necessary attention, even though we know we have inflows of migrants. They're very big now. They started in the middle 1990s. We don't have accreditation procedures. We don't have national registers. So how can we say that we need healthcare interpreters, but we don't have any way to qualify them? So that's a bit of a problem. So as we lack a national approach, we have regional approaches. And I will be briefly talking about two regions, the Emilia-Romagna region, where I teach, and the Marche region, that is the region I live in. They both pay the utmost attention to social services and to citizens' rights, and they both issued a decision on this new profession, and the name changes very frequently. So let's say the terminology they used is linguistic and cultural mediators. And you see they were issued in Emilia-Romagna in 2004 and in the other region in 2009. We also have this project, just to give an example, that our region, Emilia-Romagna in particular, is very much attentive to social rights, and they developed this initiative, the Migrant-Friendly Hospitals, that is a European project, started in 2002, and I can't linger on that. So I briefly listed a few features distinguishing the two professions. So cultural mediators, they must have a prior migration experience in Italy. That's a bit strange. It differs from the rest of the world. And this definition, if you like, is found in Italy, France, and Spain, mainly, Mediterranean countries. So they are needed, of course, to overcome cross-cultural problems. They are hired especially for less languages of limited diffusion. And they normally receive training courses in social and healthcare settings, courses that are provided by the regions, either the regions or municipal authorities. And normally they are compulsory, but if I have time, I'll show you that is not always the case. Then we have healthcare interpreters. They receive no specific training. There is no official list or order. And so, is this just a terminology issue? We know that the very concept of health changes from culture to culture. There are different ways of expressing your own symptoms. So doctors find it very difficult sometimes to understand a symptom and therefore make a diagnosis. Of course, there are other, for example, vaccination schedules that are so different from country to country. So Italian healthcare professionals should understand and respect the cultural concepts of health and diseases of other ethnic groups. So I analyzed in particular the healthcare trust's choice, and I made a survey with a colleague of mine, Dr. Rudvin, analyzing these two regions. And we saw that there are a lot of contradictions there, because most hospital administrators in the Emilia-Romagna and Marche region think that cultural mediators and not interpreters are needed. Why? But because simply they say that interpreters tend to translate words, and they don't have this more deeper knowledge of culture. But we all know that to speak a language, you need to know something about culture of the country where this language is spoken. But anyway, this is the main, if you like, sort of difference. And we have a special case, that is the Ospedale Civile of Rimini, because they have an in-house interpreting service since the mid-90s. So they really stand out, and we, of course, studied them, and we are working with them. I won't linger on legal issues, but this is just to let you understand that, of course, the interpreter's role in healthcare is very important. It suffices to think about informed consent that the patient must give, and also professional liability. Because, of course, the doctor might protect him or herself and say, I didn't make a proper diagnosis because the interpreter didn't interpret well. So I didn't get the right symptoms or signs, and therefore I made a wrong diagnosis. It's not my fault, it is his or her fault. Okay, so this is very important. That's why I insist on saying that specific training is needed. Is it available? That's another important question. Okay, we've seen that cultural mediators normally attend this course offered by the regions or the municipalities, and it is normally 300, 400 hour post-high school diploma course. But the problem is that if you look at the curricula of those courses, and of course I did, there is no stress on interpreting qualities, or they say whether they master Italian and the other languages well. This is not often asserted, and that's a big problem, of course. On the other hand, in general, university students are not offered cultural competence courses. So you see there are problems everywhere. And of course, there are big consequences for patients. So, as I told you, it was in the 1990s that this large influx of migrants began to arrive in Italy. But again, we have big problems in Italy still with languages of limited diffusion. Only a few years ago did Italian modern languages faculties or interpreters and translator schools start offering languages courses such as Arabic, Chinese, and Japanese. Of course, barring the university specialized in Eastern languages like Venice and Naples. So it's very difficult for medical professionals to find interpreters for less diffused languages, such as Farsi, Filipino, Urdu, Wolof, and all others. So I think, we all think, my colleagues and I, that universities can collaborate with institutions to offer well-targeted training programs for these professionals. So we need to be closely collaborating. So we need to organize specific postgraduate specialization course, and we also need to cater for those who are already working, but they don't have enough training. So in-service training courses are offered. We'll briefly just point out this case study that is based on a course that was based, a very short postgraduate course. It's 3 months duration, but it's based on very close collaboration with some hospitals. So the students at the end of the course have to do a work placement in these hospitals and also in the police department. But I will not talk about this. And so this course is briefly pointed out here. And what's most important is on the job experience. So they have to work in hospital for 1 week only, 25 hours, but it's at least something. And then another thing I wanted to aim at is that, of course, we used medicine on the move, terminology and scenarios, and they found it very interesting because it was a way for them to get closer to the medical profession. It doesn't suffice to learn a list of words, terminology-wise, but you have to be involved in a patient-doctor relationship. So they really enjoy that. I just finished by saying that, as we already heard from my colleague, and we know that ad hoc interpreters are often used because it is impossible to find an interpreter for Chinese. All of a sudden, we've been told, for example, by the director of the hospital Folly, that there is no problem. They are in touch with a Chinese restaurant, and if a problem arises, they call the Chinese waiter, and maybe he comes and helps them. Okay, so that's quite difficult. This was just finished by saying, for example, in Ancona, they have only a cultural mediation service. Okay, and this is a list of recruitment criteria. So they have to be migrants, as I already said. Most of them, you see, that's a very wide range. They must have at least a high school diploma, but some of them have graduation, some of them have a PhD, so it varies so much. You can't really have a clear-cut requirement. They have to know Italian language and culture, but nobody ascertains that, and they must know, of course, one vehicular language. Might be English, might be French, you know, for, I don't know, languages. And again, attending a specific mediation course is not compulsory, but suggested.
Could I ask a question?
Oh,
why
please.
do they need to have the immigrants themselves?
That's typically Italian. It's not my opinion, so it's difficult for me, but I can tell you what they say. They say that to really understand the migrants' problems, you must have shared the same experience. So you must have had, you must have shouldered this burden of coming to a foreign country without knowing the language, finding it very difficult. For example, I can tell you that where do they get these mediators from? They mainly come from an association of cultural mediators. They are migrants who, they're very good. Some, I met them, I made a lot of interviews, and some of them are really exceptional because they have the social duty. They feel the social duty of helping other migrants because they've shared the burden. So they say, okay, they don't earn much, you know, they normally do something else, and then they act as cultural mediators on top of their job to help their colleagues. So that's the main underlying idea, that they share this experience. Okay, I think I'll stop here. Please.
Wonderful. Thank you very much, Elena.
You're welcome.